So, good evening, everyone. So, in our previous class, we have seen the bones and as well as the types of muscles we have seen. Uh, the skeletal muscle, smooth muscle, and cardiac muscles we have seen. So, as the muscles which are fused with the skeleton, they are called as skeletal muscles. The muscles of the heart, they are called as cardiac muscle. Then we can identify the smooth muscles which are present aligning the internal organs like stomach, intestines, and all. So, coming to the next features of the muscles, classification of the muscles. So, coming to the classification of the muscles. So, these muscles are going to divide or classified into different types according to different properties. Suppose if we just take the architectural classification, and then architectural classification means the shape is different in some muscles. Some muscles are parallel muscles. For example, some muscles are quadrilateral, they're called as thyroid, and some muscles are strap muscles called as sartorius, and some muscles are fusiform in shape. For example, it is biceps brachii. And some muscles are oblique in nature, they are triangular muscles. Example, temporalis muscles. Okay, then coming to this, yeah, arrangement, parallel, oblique, and strap-like. Let us see one by one. So the muscles which are circular, for example, it is orbicularis oris, even the orbicularis oculi, which is surrounding the eye. Then the convergent, some muscles they converges at the ending or insertion point. And here you can identify the multi-pinate muscle. They are arising from the different areas. Okay, strap-like muscles, parallel muscles. Okay, so these are all the different muscles you are going to identify one by one. So coming to this, excuse me, yeah, unipennate, bipinnate, and multipinnate. So coming to this, the muscles they arises from one or two particular body parts, and they are going to insert to other bone. Okay, so if it is arising from one particular part, that is called as unipinnate muscle, and if it is arising from the two different parts, that is called as such muscles are called as bipinnate muscles. If the muscle is arising from the two or more different parts, three or more different areas, such muscles are called as multipinnate muscles. Okay, that is about unipinnate, bipinnate, and multipinnate. Then coming to this, yeah, let me show you this unipinnate muscle, bipinnate muscle, and multipinnate muscle. So they're arising from one particular part, that is unipinnate, from the two different areas, that is bipinnate, and three or more different areas of the bone, that is called as multipinnate muscle. Then coming to the regional classification. So according to the regions of the body, the muscles have been divided. Okay, so muscles of the head and neck, muscles of the abdomen, thorax and pelvis, and muscles of upper limb and muscles of lower limb. They're coming to this color and contraction. So some muscles they are red in color. They are red muscles, white muscles, and intermediate muscles. Let us see what are the red muscles, white muscles. So one is red muscles. These are slow, or these are also called as slow fibers or type 1 fibers. They are red in color because of the large amount of myoglobin protein. So these fibers are rich in mitochondria and oxidative enzymes, but poor in phosphorylases enzymes. They are highly resistant to fatigue. These are highly resistant to the fatigue. Then coming to the white muscles, these are pale in color because of the small amount of myoglobin. The fibers are rich in glycogen and phosphorylases but poor in mitochondria and oxidative enzymes. These are also called as type 2 muscle fibers, whereas red muscles are called as type 1 muscle fibers, and white muscles are called as type 2 muscle fibers. The nomenclature, how the muscles have been named. So muscles have been named according to the shape. According to the shape. So these are all the things we need to mention in the examination when they ask about the muscles and its classification. So classification means regional classification, structural classification, and according to their shape. According to their shape, they have been named. So what are the muscles are named according to their shape? First one is trapezius. According to their shape, The muscle name is trapezius. It is in the shape in the form of trapezium. Then rhomboidus, as it is in the form of a rhomboid, so it is called as rhomboidus according to the number of heads of origin. So this biceps, it is arising from the two different areas of the bone, that bones called as biceps, and triceps, it is arising from the three different areas. Then according to the gross structures, some muscles are there semitendinosus. Some part of the muscle, it appears like a tendon, so it is called as semitendinosus. And semimembranosus, some part of it, it is appearing like the membrane, called as semimembranosus. According to their location, so as it is located in the temporal region, the muscle is called as temporalis supraspinatus. Then according to their attachment, stylohyoid means styloid process of the temporal bone and the hyoid bone. Cricothyroid, between the cricoid cartilage and the thyroid cartilage. So these are all those muscles which have been named according to their shape, according to the numbers of heads of origin, according to the gross structure, according to the location, according to their attachment, according to their action, according to the direction of the fibers. So this is the nomenclature of muscles, means names, how they have been named. Then coming to the naming of the skeletal muscles. So here, try to look at here. So the trapezium, it is appearing, it is in the form of a trapezium shape. That's why it is called as trapezius. Trapezius. Then we can identify serratus anterior. Serratus anterior. So serratus anterior, which is a muscle, is present in the anterior aspect of the thoracic cage, which is arising and extending posteriorly and reaches to the scapula. Okay, shape. Try to see the shape. Deltoid means triangular in shape. So as it is arising from three different areas, means anteriorly it is arising from the clavicle, laterally arising from the acromion process, and posteriorly it is arising from the spine of the scapula. Then trapezius. So trapezoid, it is in the form of a trapezoid, two parallel sides. Okay, serratus means sawtooth, sawtooth. Then rhomboidus means it is in the form of a rhomboid shape and four parallel muscles, four parallel sides. Orbicularis and sphincters, circular in shape, as they appear, they as they present in the form of a sphincter, circular, they are called as orbicularis. Okay, so then muscles named by the size. Maximus. Suppose if you see this, so as major, minor. If it is bigger, it is called as major. If it is smaller, it is called as minor. Maximus means largest. Gluteus maximus. Then minimus. Gluteus minimus. Smallest. Then longest means longest. Brevis means short. And major means large. Minor means small. Then coming to the muscles named by the direction of the fibers, external oblique. They are oblique in nature and they are present. They are running downwards, forwards, and medially. Okay, external oblique. Then rectus. Rectus means stride. Okay, parallel rectus abdominis. Rectus abdominis, muscle of the abdomen. Okay, here you can identify. So the muscle which is gives six pack, eight pack. So that is nothing but the rectus abdominis muscle. Then transverse. Here transversus abdominis. Below this external oblique, we can identify internal oblique, and inside we can identify transversus abdominis. Means it is the fibers are running transversely, so it is called as transversus abdominis. Then oblique means oblique in shape. Then coming to the biceps brachii, as I told you earlier, it is arising from the two different areas. One is from the coracoid process of the scapula, another one arising from the supraglenoid tubercle of the scapula. And that is about biceps brachii, two heads. Triceps means three heads. Quadriceps means four different muscles, four muscles, quadriceps. Okay. Then coming to the muscles named from for origin insertion. Suppose if we just look at this muscle, the neck muscle, which is called as sternocleidomastoid, it is arising from the sternum, and another head is coming arising from the clavicle or collarbone, and the muscle is extending upwards and reaching to the mastoid process for insertion. That is called as sternocleidomastoid, according to the name of origin, name for origin and insertion. Okay. Then muscles named for action. Suppose if you see the flexor carpi radialis, the name itself it is saying it is responsible for the flexion. Carpi means carpals, radialis as it is present laterally it is called as radialis. Extensor carpi radialis. it is responsible for the extension. So it is called as extensor. Carpi means carpals. Radialis means as it is present laterally, that is called as radialis. So then coming to the abductor pollicis brevis. Abductor means the muscle responsible for the abduction. Pollicis means the thumb of hand. Then brevis means short. Okay, brevis means short. Then coming to the abductor magnus. Magnus means big muscle. Okay, abduction. Abduction of the thigh. Abduction of the lower limb. So that is called as abductor magnus. Okay, extensor digitorum means the muscle which is responsible for extension movement of digitorum means digits means fingers. Okay, so that is about the muscles named for action. Okay, next moving forwards and try to see the types of muscles contraction. So this is about isotonic contraction, isometric contraction. So you don't no need to worry about this contraction and all. So again, when you read the physiology, you will understand clearly how it goes. So this is isotonic contraction and isometric contraction. Then coming to the muscle tone, some fibers are contracted even in a relaxed muscle. Different fibers contract at different times to provide muscle tone. The process of stimulating the various fibers is under involuntary control. Okay. Then effects of exercise on muscle. Results of increased muscle use an increase in muscle size, increase in muscle strength, increase in muscle efficiency, and muscle becomes more fatigue resistant. Okay, so these are the results of exercises. Exercises. Then coming to the types of ordinary movements, these are flexion, extension, rotation, abduction, adduction, circumduction. These are normal ordinary movements what we do with our body. Okay, the muscles. Some muscles are responsible for different movements. Functions of the skeletal muscle. Functions are one is movement. Muscle move bones by pulling and not pushing. They doesn't push. They pulls. They pulls. Okay. Then synergies. A group of muscles. Group of muscles doing one particular movement. They are called as synergies. Okay. The one that is most responsible for the movement is called as prime mover. Suppose when you are flexing your elbow joint, there are different muscles are present in the arm which is a part which is present between shoulder joint and elbow joint. The muscles, there are three or more muscles are present. Every muscle is responsible for the flexion of elbow joint, but one muscle is acting more. Such muscle is called as prime mover. All the muscles they are called as synergists. One muscle plays a major role called as prime mover, called as agonist. Okay, then another muscle which opposes the action called as antagonist. Okay, then moving to the functions of, yeah, antagonist. Here I'm, as I told you earlier, the muscle which is opposing the action called as antagonist. Okay, then levators, muscles which rises the body part called as levators. So suppose if you just look at our face, there are some muscles which are responsible for the levator labii. Labii means the lip. So superiors, levator labii superiors, the muscle which is responsible for the elevation, raising the upper lip called as levator labii means lip superioris. Man means as it is present in the upper part. Okay, then coming to the differences between skeletal, smooth, and cardiac. Skeletal muscles long and cylindrical, then smooth muscles spindle shape, cardiac short and cylindrical, then fibers unbranched in the skeletal, fibers unbranched in the smooth, then fibers branched in the cardiac in the place of cardiac. Okay, try to just make a note of these differences between the skeletal muscle, smooth muscle, and the cardiac muscle. Okay, this is very important to remember these things. Okay, so here you can identify the skeletal muscle, cardiac muscle branched, and smooth muscles. So clinical anatomy is paralysis. Loss of muscle power is called as paralysis. Paralysis means loss of muscle power or loss of motor innervation of the muscle called as paralysis. So causes are upper motor neuron or lower motor neuron lesion by inherited disease of the muscles called as myopathy. Okay, damage to the upper motor neuron causes spastic paralysis. Lower motor neuron causes flaccid paralysis or loss of tendon jerk. Okay, so muscle spasm is caused by muscle pull. Generalized muscle spasm is caused by tetanus and epilepsy, means fits. Then disuse atrophy and hypertrophy. When muscle is not used for a long time, it becomes atrophied and thin. This is called as disuse atrophy. So adequate or excessive use of particular muscle causes their better development and even hypertrophy. Let us see this. So here this person is using his muscles more, called as hypertrophy. He may going to face a hypertrophy, and here you can identify atrophied muscles. So if you doesn't use your muscles, then all the muscles they will become atrophied. If you use more, you will become hypertrophied. Then hyperplasia, increase in number of smooth muscle fibers called as hyperplasia. Myasthenia gravis, it is an autoimmune disease. Autoimmune disease. Then here identify neuromuscular junction. So how the muscle is going to contract. Okay, so the nerve which is supplying to the muscle at the terminal part, you can identify presynaptic nerve, and the muscle we can identify postsynaptic nerve. Okay, so the muscle nerve is supplying to the muscle. In that nerve, at the terminal end of the nerve, we can identify some vesicles called as synaptic vesicles, which are storing the neurotransmitter called as acetylcholine. That acetylcholine is going to release from the synaptic vesicles which are present in the nerve by the help of calcium ions and by the help of mitochondria. Then that acetylcholine is released, and that acetylcholine is received by these receptors which are present on the muscle called as acetylcholine receptors. Then the muscle will become contracts. Soon after contraction, the acetylcholine enzyme, that acetylcholine neurotransmitter, it will be killed out, or it will be washed out by acetylcholine esterase enzyme. Okay, so here you can identify destruction of acetylcholine neuromuscular connection. Okay, so this is thing we will study once again in the nervous system. Okay, then poliomyositis, it is the disease of muscle characterized by inflammation of muscle fibers. It starts as a white blood cell invade muscle close to the trunk are mostly affected, that results in severe weakness. It is a viral effect, polio virus. Then fibrillation, it is abnormal contraction of cardiac muscle. Okay, atrial fibrillation and ventricular fibrillation. Angina pectoris, episode of chest pain due to temporary ischemia of cardiac muscle. It is relieved by the rest and nitrites. Okay, these are the things we're going to study in the cardiovascular system. Then come to the myocardial ischemia. These are all the clinical aspects you can study one by one, and they are very helpful. Then coming to the muscles of upper limb, what are the muscles you can identify? So the muscles which are very important for paramedical students. So as I am doing this video for paramedical students, try to concentrate on these muscles. Okay, so this is a clavicle, the collarbone, and the flat bone is called as scapula. Then you can identify a long bone called as humerus. Okay, then what are the muscles we can identify in the pectoral region? So pectoral region, yes, here you can identify. So the pectoral region which is present in the thorax, anterior part of the thorax, the chest region is called as pectoral region. In the pectoral region, we can identify these muscles: pectoralis major, pectoralis minor, subclavius, serratus anterior. Let me show you all these muscles. So this is a muscle called as pectoralis major. Major means big muscle. So it is arising from different areas: clavicle, then sternum, and from the ribs, even from the aponeurosis, means the flattened tendon of the muscle. From that particular part, this pectoralis major, it is also arising. The pectoralis minor, so below this major we can identify the minor, which is arising from the third, fourth, fifth ribs. Okay, so that is about pectoralis minor. Then coming to the serratus anterior, serratus means sawtooth. Okay, serratus anterior is arising from upper eight ribs, and these muscle fibers going posteriorly and reaching to the scapula, medial end of the scapula. Okay, then coming to the subclavius, the name itself it is saying sub means below, clavius means clavicle. Below the clavicle, we can identify subclavius muscle. Then it is an important muscle for you people. One is deltoid muscle. So the deltoid muscle, it is arising from clavicle, lateral one third, anterior border of lateral one third of clavicle. Please make a note. Write down these things. Anterior border of lateral one third of clavicle, From this part, anterior fibers are rising. Then from the lateral margin of acromion process, lateral fibers are arising. Lateral fibers arising from lateral margin of acromion process of scapula. Then you can identify the lateral margin, lateral border of acromion process of scapula. Then posterior fibers, they are arising from the spine of the scapula. From these different areas, this deltoid muscle is arising, so that we can call it as multipennate muscle. Multipennate muscle. So these muscle fibers which are extending downwards and reaching to the deltoid tuberosity of humerus. So this is the origin. Origin is clavicle, acromion process of scapula, and the spine of the scapula. And insertion is, it is going to insert to the deltoid tuberosity of humerus. Okay, so that's about the deltoid muscle. So this muscle is supplied by axillary nerve, which is supplying to this deltoid muscle. So what is the clinical importance? Intramuscular injections will give to this deltoid muscle. Okay, so deltoid muscle. Then coming to this arm muscles. Other arm muscles are, one is coracobrachialis. Coracobrachialis. This is not important for you guys, but remember coracobrachialis, it is a muscle of the arm. Then we can identify other muscles of biceps brachii, and posteriorly we can identify triceps brachii. Below to this biceps brachii, we can identify another muscle called as brachialis. Okay, so that is about the muscles of upper limb. So other muscles which we can identify are, so the rhomboids major, minor, trapezius muscles we can identify posteriorly. Yeah. Other muscles around the scapula, the teres major, teres minor. Then you can identify the latissimus dorsi muscles. Latissimus dorsi muscles. These are all the muscles of the upper limb. Coming to the lower limb, this muscle is very important for you guys. Why? Because most of the times they ask in the examination, gluteus maximus means bigger muscle. So the gluteus maximus is arising from the hip bone. Hip bone. Okay, so behind the posterior gluteal line, we can identify it is arising, and also from the iliac crest, and the sacrotuberous ligament, and from the sacrum, it is arising. So remember, one is hip bone, iliac crest, then sacrotuberous ligament, and from the sacrum. Okay, from these different areas, the gluteus maximus is arising, and it is getting inserted to the gluteal tuberosity. Deltoid is getting inserted to the deltoid tuberosity. Gluteus maximus is inserted to the gluteal tuberosity. And this muscle is supplied by inferior gluteal nerve. Inferior gluteal nerve. So the action of this is lateral rotation of the hip joint, lateral rotation of the hip joint. And the clinical importance is intramuscular injections will give it to this upper lateral quadrant of this muscle, gluteus maximus. So if we just try to divide into four different areas, so this is the medial area and this is the lateral area. So upper lateral area, this area is safe for intramuscular injections. So that is about the muscles. Thank you, students. Thank you.